Chris Nelson. I'm a clinical psychologist. I work at Sloan Kettering Cancer Center, and I work a lot with men with prostate cancer. And when you work with prostate cancer, you work a lot with sexual dysfunction. So often talk with men about things like anxiety, stress, and how it impacts sexual performance. So performance anxiety in a sexual situation is where one person or both in the couple become just really nervous and anxious about what's happening in the sexual experience at that time. And it can happen to both men and women. For men, it happens around things like, can become really nervous, stressed out, anxious about kind of erections. Are they getting erections? Is it staying hard enough, long enough? For women, it might be around things like, how they look, self-perception. Do they feel sexually attractive? And for both of them, both men and women, it can be around concepts of, am I doing this right? And what can happen is that you start to become nervous and anxious in a sexual situation. And if you become anxious enough, what happens is actually triggers a physiological response. That is, when you become anxious, one thing that happens is that adrenaline is released into your system. And so when adrenaline is released into your system, adrenaline's purpose is to pull blood from non-vital organs to vital organs. So for men, unfortunately, adrenaline doesn't think the penis is a vital organ. So a man's erection sometimes will happen as adrenaline will pull blood from the erectile tissue, making it harder for men to have erections. For women on the physical side, the physical response is just like men. If adrenaline is present, those physical responses can become more difficult. And then what happens, it just becomes a downward cycle, right? So you might feel kind of some nervousness and anxiousness. And then what happens if you feel a physical response like, boy, I'm not performing the way that I want to, or the way that I should, or the way that I think I should, you become more nervous and anxious, right? And then that just starts a downward spiral. Yeah, so porn use, right, it's controversial for sure. Like in general, kind of if you look at the research, there's nothing really quote unquote bad about porn use, right? In general, most of the research indicates maybe some minimal effects just in terms of how porn use might impact the person who's watching it. What porn use can do, though, is set up expectations that are unrealistic. And so porn use for men might mean kind of the size and girth of a penis that they're seeing kind of, in the porn, or how long that man stays hard in a porn situation. Oftentimes what happens when they're filming those porn videos is actually men are using like a pill, like, PD5 inhibitor that helps with erections, or they might actually have a penile injection to help with erections. So they're artificially staying hard throughout kind of this process. And that can just apply more anxiety for men around size and girth of penis, and then how long they're supposed to last. For women, of course, things like self-perception, kind of those women in porn videos are chosen for, essentially a certain type, like perfect body, and women can view that and feel self-conscious as if they're not matching up, which can cause anxiety. And so again, porn use is not necessarily bad, but it can set up certain expectations that might then influence anxiety and pressure in a sexual situation. If in fact kind of this notion of anxiety takes over, whether it's for a man or a woman, and they're not performing the way they want to in a sexual situation, then that can have an impact on the couple, of course, around what's happening not only in the bedroom but outside of the bedroom, but also individually. So if a man has difficulty with erections because he's feeling nervous or anxious, those difficulty with erections can actually translate, again, not only in the bedroom, but actually outside of the bedroom in terms of his self-confidence, just in his normal everyday activities, whether that's with his friends, whether that's at work, or whether that's with his relationship. So these things, right, so, you can understand that there's a bidirectional relationship on all these things. Life activities, right, impact anxiety and stress that might enter into a sexual situation. And then anxiety in a sexual situation then may in fact kind of impact what's happening in life. So practical strategies have to do with, like big picture conceptually, it has to do with taking the shift from performance, what I look like. Am I getting hard? Am I hard enough long enough, right? Am I big enough? What do I look like? Do I look like, appropriate, right? Am I attractive enough? So trying to take that focus off of performance and putting it back on pleasure. And so what does that mean? That means trying to focus on those things that you enjoy in a sexual situation, right? Whether those are the physical sensations, whether it's mentally kind of what's hot about the sexual situation. Because any type of stress is going to pull you out of that or away from that. And so strategies, big picture, trying to focus more on the pleasure and enjoyment of the situation. If it's a couple, good couple communication. If there's stress in a sexual situation, it's not a mystery for anyone in the couple. They're both experiencing it. So talking about it can help relieve some of that stress and anxiety, talking through kind of strategies on, that the couple can brainstorm and talk about what can make both of them feel more comfortable. And so those types of strategies are the ones that can be most helpful. And so the notion of performance anxiety, sometimes called bedroom head, right? This notion of I'm just totally in my head and I'm distracted and I'm anxious. This is not necessarily a permanent thing. And as whether it's happening to the man or the woman, whoever it's happening with, as you become more focused on the pleasure, you become more relaxed. Generally what happens is your body's natural reaction then starts to take over. And then what happens is your natural body starts to take over. You're starting performing like you think you should. And then what happens, then that starts the upward spiral, which helps you focus more on the pleasure and the enjoyment of the situation. You kind of get into it more, which then helps your body respond more. And so these things are not permanent, and certainly these strategies can help. And so, just understand that, as you utilize these strategies, hopefully what happens, and what happens for most people, again, is that their body starts to work normally, and they engage in a way that they used to. Yeah, so for something like this, those strategies are the first strategies to try, right? Which is focusing on pleasure instead of performance, good couple communication, talking about it. If those strategies don't necessarily work or they're not working as well as you think they should, then something like seeing a mental health professional can be really helpful. And that mental health professional can be someone who's a psychologist who has some experience of working with sexual issues. There is a specialty of sex therapists who really focus on working with couples around these specific issues. And what's going to happen is that mental health professional is just going to talk with either the individual or the couple and talk through these strategies. Oftentimes, even the discussing and talking about it helps relieve some anxiety about what's happening, helps normalize this experience. This experience generally happens to most people in sexual situations as they kind of live their lives and have their sexual experiences, and so normalizing it. But it's this type of work with either, again, psychologist or a sex therapist that can help the individual or the couple really work through these types of things. Medication itself, usually for something like this, medication isn't something that's needed. If whoever is struggling with the anxiety in a sexual situation, if this anxiety is really a holdover for what's happening in life, and you're feeling nervous and anxious and stressed in life, or you're feeling down and depressed and distressed in life, those are the times where medication might be helpful. But we think probably much more of a bigger picture at that point, as what's happening with this person, not only in the bedroom, but kind of in totality of what's happening in their life. For something like this, we're really talking about psychological causes. And psychological causes in quotes, right? So what is it? It's just kind of what I've talked about, which is this anxiety that creeps into a sexual situation. So it's not necessarily a physical cause for this anxiety. Sometimes, though, like the start of this and what can start the kind of the downward cycle of anxiety and distress, less performance, anxiety and stress, less performance. What can start that is an experience. I'll just use kind of a man, for example. Let's say man is really tired or fatigued or had a lot to drink one night. And then that man enters into a sexual experience. And either because of the tiredness or the fatigue or the drinking, he's not able to have an erection that he's used to. He becomes nervous and anxious. Right? Well, then the next time in a sexual situation, he may be thinking about that last time. And that may start the process of anxiety even as he's entering in the sexual situation. And so as he thinks about the sexual situation, becomes nervous and anxious, right? That starts then that downward spiral of him being, wow, overly concerned about what's happening with his erections at the start of the sexual experience. If that then triggers the biological response of adrenaline, it's going to be harder to have an erection. It's going to become more nervous and anxious, and it starts the downward spiral. So the core base of these things, it's really just an anxiety response, a kind of a performance anxiety, even like athletes might have, right? So athletes, when they get in their head and they become really nervous and anxious, like, their performance dips, same type of thing. Could it be triggered by some type of physical response? Yes, absolutely, and sometimes that's what triggers it, but it's not the base, it's not a physical type of a condition. It's more, again, just a stress, anxiety response to certain situational aspects. For this situation, there's two levels of stigma that hold people back. One is kind of the sense of feeling ashamed that they're not performing in a sexual situation. They're probably confused, not sure what's going on, and so that sense of stigma then can be like, boy, what's wrong with me? And I feel ashamed even admitting it or talking about it. Right? So that's number one. Then the other source of stigma might hold them back for treatment if in fact seeking treatment or assistance from like a mental health professional or a sex therapist. Of course, there may be stigma related to that too. And so those two kind of elements, right, can hold people back from pursuing help and assistance, when in fact this is something that probably happens to most people at some point in their life, right? And just in terms of, everyone has times and periods in their life when they're feeling stressed or feeling anxious or feeling down, and there's no doubt that can impact the sexual experience. And so one of the messages is that this happens to a lot of people. It's potentially normal to some extent throughout your life to have some of these experiences. You shouldn't feel ashamed by it. As much as you can, focus on the things like what's pleasurable about the sexual experience. So again, both from the physical sensations and kind of the fantasies, what's hot about the sexual experience. That helps increase the enjoyment, takes the focus off of performance, and hopefully starts this spiral upwards where there's more success and enjoyment in the sexual experience. Most people in their lives, as they experience kind of their sexual experiences, something like this will happen. And so number one, know that you're not alone, it's normal. Number two, there's ways that you can address it. And once you do, your body's going to react normally. You're going to feel more like yourself. And then after that point, you're going to continue with your sexual experiences in a way very similar to what you did before this notion of anxiety or stress creeped into the situation.